New at 10, the mental health crisis in the construction industry is not only terrible for workers' health, it's also shrinking the workforce. It's also driving up building costs. Thanks for joining us for 2 News at 10 tonight. I'm Mark Cabell.
And I'm Heidi Hatch. Glad you're with us. We told you last night about the silent crisis in the industry that nearly tops the list of occupations with the most suicides. Brian Will live for us and explains the growing effect of this troubling trend. Brian.
Heidi and Mark, work sites like this mean long hours, tight deadlines, and it only gets worse with less people to do it, especially in a growing state like Utah, which only see more construction projects, and that doesn't help with the mental health crisis.
They're dealing with manpower issues that they have no control over. They're dealing with a deadline that has already been set that likely isn't moving. They're dealing with Mother Nature and weather.
A leave-it-at-the-gate mentality will no longer work, says Slade Opheikens, the president of R&O Construction, which has over 100 employees.
We've been booked out for probably the last 5 years, at least 6 to 12 months in advance with all our teams. And
the industry generally is just getting faster. The expectations are getting higher.
As demand grows, so does the strain on workers. With more than 5,000 deaths by suicide each year, and a fifth of them abusing drugs and alcohol.
The industry is experiencing a huge labor shortage across the board, and this is a big factor in all of this.
Professor James Smith at BYU is conducting a long-term research study on mental health in construction. He says the lack of workers makes the production pressure worse and the work less appealing. That can drive up the cost for construction projects, which is why addressing the total worker health can help across the board.
Even from a bottom line perspective, it has a very positive effect.
It's not just the financial impact to a project, it's the impact on those that are doing the works.
Opheikens says ways to address that is to reduce those tight deadlines and make sure there are mental health resources available and just talk about it. And this is in an industry that's projecting growth of more than 600,000 workers each year, so it makes it even more important to address. Reporting live in Salt Lake County, Brian Will, KUTV 2 News.